Thank you so much for this platform, and it's an honor and privilege to be sharing it with such eminent and senior faculty members. So, before I begin and we go ahead and talk about addressing stigma associated with type 1 diabetes, I think stigma is something we can't understand till the time we have been through it, we have faced it. Though we've been talking about AI and technology, and a lot of data while looking at patients having type 1 diabetes or type 2 diabetes. But I think it's now time to change our lens and look at humans as somebody who have a social and emotional aspect to their lives. So I will just share my screen and keeping it very precise, I will talk about some real life cases which talk about the stigma that children or people living with type 1 diabetes face. So just to begin with, I mean, there are a lot of examples. These are a few that I have picked up. So this is a real life case where a 12-year-old boy did not attend the school for one whole month because he was bullied in school by his sports teacher and his peers for frequently going to the washroom and going blank while writing a test. So this was a case where this boy was recently diagnosed, say about 2 to 3 months after that he started going to the school because of the initial fluctuations that happen and the kind of control that we try to achieve, but we are still learning, we are in the learning process. So this happened with this child and he actually was being bullied, and there was a lot of name calling that was happening to him. So he came back and he told his parents that I will not go to school. We could not understand the reason till the time we sat with him, we talked about this with him in a counseling session. Similarly, a 28-year-old female was being mistreated at her in-laws place because she was seen taking insulin at home. So this was a case of a love marriage where the husband was supportive. He knew about his wife having type 1 diabetes, but this was not disclosed to the in-laws. So one day the mother-in-law saw her injecting something, and then all of this started where she was again mistreated and she was being told that she's not capable of being a wife, being a daughter-in-law, or having a child, and so on and so forth. So this was a very, very difficult situation for the entire family to deal with, and it took us a lot of time to intervene and work through this situation. The third case is also of a 19-year-old boy who started skipping insulin injections at social gatherings when in one of the parties, someone questioned him if he's on illicit drugs. So, the insulin syringe is often mistaken for children to be taking maybe drugs or something, people who are not aware of it. And this was a high-end social party where he was. And this person came up to him and saying, "What are you taking? Tum kya, kaun sa drug le rahe ho?" And this boy was confused and shocked, and he was in such a bad situation. He was actually traumatized by this kind of a question which was asked to him, and he stopped taking insulin injections. He didn't take it to his college, he didn't take it outside. He always skipped taking insulins if he had to go out for a gathering, etc. So these are some cases which talk about the stigma and the discrimination that children or adults having type 1 diabetes face on in the daily life. So let's understand what stigma is. It's a strong feeling of disapproval that most people in society have about something which does not fit the social norms, right? Something which is different. And when you start labeling people, when you start judging people or name calling people, it leads to a lot of mental trauma. So, people having chronic ailments like type 1 diabetes have difficulty in finding a spouse. There is discrimination at employment opportunities in academic institutions. Management of disease becomes difficult. There is poor quality of life because of the low self-esteem, the depressive symptoms, and the overall management gets affected. Research says that people do not like to use a CGM device like a device like a CGM or insulin pump because of the diabetes stigma that has an impact of their decision to forego this technology, hence leading to mismanagement. Those who can afford also, they also prevent from using it because of the stigma that is attached to it. So this research paper said that there are about 63% people who have reported device related stigma when it comes to managing type 1 diabetes. So, what are the implications of this stigma and discrimination that we face? There is, of course, low self-esteem and body image issues among adolescents. And sometimes it becomes so serious that people have come up with suicide ideation and suicidal tendencies because they have been bullied, they have been discriminated, not just at school or in social gatherings, but even at home. So, this discrimination also begins at home, right? So there is dysfunctional social relationships and there is an impact on education. Then this impact, which starts in the childhood, is often carried, while you're growing up, and you develop your habits and behaviors according to these experiences that you've had during the childhood, basis the stigma and the negative experiences that people and the society has given you. Discrimination at workplace, perception that people with type 1 diabetes are incapable of certain tasks since they have to take breaks to take their insulin. They might have hypoglycemia where they have to go take a snack in middle of the working hours, etc. So, of course, stigma related to type 1 diabetes can lead to mental stress, depression, not only for the children or the person who is living with type 1 diabetes, but also the caregivers and the parents, because they have to do things differently, right? The needs of their child is a little different from other children. So that takes time for all of us to adjust to. But when the society or when people around us are not supportive, are not cooperative, it becomes all the more difficult. So when there is name calling, there is labeling, this leads to disruption in their medical regime. So the child or the adult or the person living with type 1 diabetes feels feels a kind of shame in monitoring their blood glucose levels, be it through pricking or through CGM, taking insulin injections in public, or wearing a pump, or eating something which is different from other kids or other people. Children become rebels against the self-care practices, right? And this leads to complications in treatment and therapy. Of course, if you feel that you are being stigmatized, you're being discriminated, there is prejudice against you, you will not want to do things that make you feel different from others. So there is this denial, of course, with this kind of a chronic ailment coming, being diagnosed, and then the non-supportive attitude and behavior of people around us makes it difficult for us to actually follow this self-care practice, right? So how do we address this social stigma? Now, addressing this social stigma is not something which can happen right there, right now. It's a shift in the entire social behavior, right? This is a long-term process, requires conscious commitment, persistence, and patience. And this change should ideally start from the immediate family. How you perceive the ailment, how you perceive type 1 diabetes, this can be one of the starting points. If you take it as something like your new normal, it starts becoming a little easy gradually. And how you communicate it to others while you're outside, that also plays an important role in changing that social behavior and perception towards the ailment. Advocacy through data-driven approach. So this is very, very important and has shown a huge impact recently that, when there is a lot of data which shows how the negative long-term impact on diabetes, affects these individuals, their sugars, their whole quality of life, uh, we can we can actually understand that, okay, this is a huge problem. This is a grave problem when we have the numbers in front of us. So we can develop programs to create education and awareness regarding the stigma that is associated with any ailment of this sort, and counseling interventions to work with local communities. So, there is this the recent step taken by NCPCR where we have now allowed children in schools to carry a snack and glucometer during their exams. This is a result of advocacy and petitions which was filed by children living with type 1 diabetes. So this was a welcome change. Similarly, in the American schools, there is this ADA Section 504, which lays down some protocols for children living with type 1 diabetes to be followed in school. So something similar is required in our society, in our country, to make sure that children feel included. There is this inclusion that child with any chronic ailment for that matter, not just type 1 diabetes, is not discriminated, is not stigmatized. When we talk about something like a type 1 diabetes, which is relatively a new concept than other ailments, the role of social workers, the already existing resources like the ASHA workers and the primary healthcare providers becomes all the more important. We tend to forget that there are people, there are children who come from, low resource settings. They are not able to afford the basic insulins or the, syringes to take, to have a proper treatment. We can't even think of the kind of stigma and the discrimination they'll be facing. So the role of social workers and ashas becomes all the more important at the grassroots level. If we train them, they can help in educating the community and prevent the spread of miscommunication. So misinformation is one of the biggest problems when it comes to something like type 1 diabetes, where we often talk about reversal, confusing it with type 2 diabetes. We talk of alternate therapies working for type 1 diabetes, which is all misinformation being spread. So these resources can help us prevent the spread of misinformation. School programs and training of medical staff, this is all the more important as a child spends about 8 hours every day in the school. So there can be fun and learn programs with real life examples of adults leading a normal life with diabetes to see that make children see that their peers with type 1 diabetes are not different from them. This will not just motivate the child with type 1 but others, in the school, to see that this is something like, a normal, somebody who's not able to see wears a specs, right? So somebody who is deficient of insulin is just taking an insulin shot. Um, all the more, and my favorite is the counseling, the support groups, which have proved to be very, very successful, as per the research and my limited personal experience, where people come together, share their experiences, talk about their problems, their stresses, and seek that social and emotional connect with each other and help, this helps them cope up with their condition very, very well. So counseling of children with diabetes, counseling of the parents and the caregivers, as well as talking and spreading more information, correct information and education to everybody around becomes very important in addressing the social stigma. So, all in all, a collaborative approach between the government, the private health practitioners, the doctors, and the civil society, the non-profit organizations. There are various organizations which are now working for type 1 diabetes, is required to actually come out with education and information and awareness which can help people lead a normal, a stress-free life with less of mental health issues. So that's from me. Thank you so much.